Oh, that was as exciting as an Elvis concert.
Yeah, exactly. Yeah, a current Elvis concert. Let me wake up first. But like Steve said, the cat's out of the bag. You know, you're set between 12 and 15 million people minimum that we have no clue what, you know, of what they're going to do.
We don't have a healthcare system to support it.
No.
Welcome to the Dr. Frank and Steve podcast with your hosts, Dr. Frank Williams and Dr. Steve Snodgrass, MD, FACS, where we discuss a broad range of topics without limitations. Let's get to it. Here's Dr. Frank and Dr. Steve.
Hello, welcome back. This is the Dr. Frank and Steve podcast. I'm your host, Frank Williams. This is Dr. Steven Snodgrass, MD, FACS, and today we're going to be covering a topic that doesn't get much attention in the news, even though it's come up a little bit in the last month or so, but it's still a major health concern around the world, and as Steve believes and I believe, I think coming into the spring and summer, especially here in the U.S., you're going to see it exponentially explode. So we're going to be covering malaria today. If you're not familiar with it, I'm going to let Steve go over all those, and I'll be jumping in with, you know, some of the military stats and just some general stats and information. And so hopefully you'll enjoy it and learn something from it, and maybe find things you should avoid. Steve?
Yeah. Well, it's really kind of amazing. And when you look at the history of malaria as far as humanity goes, I mean, it's like a disease that's been here forever. And it's one of those things where it's going to be a bigger problem here than before. And it's a disease that affects about 250 million people around the world annually, and causes 600,000 deaths plus per year. And what's interesting is that malaria was eliminated as a public health problem in the United States in the mid-1950s, and then we were declared by the World Health Organization in 1970 to be malaria-free. And that, you know, that's not going to take into account a few people who sporadic cases that travel to the places where it's endemic and then bring it back. So, you know, but now, and I'm sure you'll hit it, but we're facing a lot different issues now. But the thing about it is we want to cover this like no one else is covering it. And I think that it's being downplayed a little bit right now for probably a lot of different reasons. You know, political, economic, political. Yeah. But it's and like political. But it's something that is solid science, and we need to understand the solid science behind it, and then you can make up your mind about the other stuff. Right. But the whole point is understand what you're talking about, and then talk about it. Right. And so there's 5 species of Plasmodium. It's caused by a Plasmodium parasite, and it's typically transmitted to humans through the bite of an infected female Anopheles mosquito. And so she, if you will, that's the pronoun I'm going to use for that, is that she is the carrier for Plasmodium parasites. And if we look at the genus and the species, it breaks it down even further, and it's important because here's the 5 different types of malaria: Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, Plasmodium ovale, and Plasmodium knowlesi. That's something that a lot of people probably didn't know. No. Don't you think?
Probably come up and scramble.
I would think you would be quite good if you start throwing that out there. But anyway, it's important because if you look at Plasmodium falciparum, it's the most common type of malaria, but it's the most deadly. And so that's a bad thing. Yeah. And then the second kind is Plasmodium vivax, the second most common type of malaria. And once the Plasmodium parasite gets inside the human body, it's associated with extremely high fevers and shaking, chills, and by infecting and reproducing inside human red blood cells. And you know, I'm a member of the American Medical Association, and so I'm kind of privy to different aspects of this. And like if you're watching a video of this that I got to see, it's like a horror movie. You know, it's like, oh, that's really happening. I mean, that's like Alien, really. I mean, it's just like the movie Alien. It's like, oh my God, there's a parasitic infection for you. But basically, when the parasites it's in the mosquito saliva and it's injected into the human bloodstream, and then once it gets into the bloodstream, it goes into the liver, and the parasite matures in the liver. And then once it's mature, now it's capable of infecting. And so it just pops through the liver back into the bloodstream. And then when it does that, the invasion of the red blood cells causes the symptoms, and they're remarkable symptoms: very high fever, muscle and joint pain, nausea, vomiting, diarrhea, abdominal pain, headache, coughing, decreased level of consciousness, difficulty breathing, severe anemia, because eventually the red blood cells are destroyed, are made more fragile, they just are destroyed. Multi-system organ failure, seizures, and possible death.
Yeah.
So it is one mean disease.
It is no joke.
It is one mean disease. And how it's diagnosed is based on just the identification of the Plasmodium parasites on a sample of blood looked under a microscope. There's also some rapid diagnostic testing that can be used. And this is another thing that people need to be aware of, is like, you know, some of these symptoms, I mean, they're flu-like.
Yes.
And so it's like you can sit around and think like, well, you know, I can beat this, and you know, I'll just sit at home and just do what I normally do. And like all of a sudden, you know, you are wasting some significant time that could be the difference between life and death. And so, especially in the falciparum, if you've got that kind of malaria, it can rapidly progress from basically an uncomplicated disease to a severe form of disease that has an extremely high death rate. And so the people that are susceptible to that the most, it's like any disease: young children, older people, pregnant women, and then immunocompromised people. So, but no matter what, if you look at the cases of malaria here in the United States, it's like, you know, we have a death rate of less than 2%.
Right, we're the lowest in the world.
But it's almost 100% fatal. I mean, that's what we're looking at, and you know,
is that because people wait so long to get treated, or doctors misdiagnose it because they think it's the flu, or?
I think most of those deaths
or they just don't test for malaria.
They don't have access to good health care. And you're seeing it like the majority of deaths are in sub-Saharan Africa.
Yeah, I think 94% are in Africa.
Yeah, I mean, it's really high. And so it's like, you know, I can tell you, when I graduated from med school, they said, where are you going to hang out your shingle? It was not sub-Saharan Africa. So, you know, there you go. But I'm just saying, you know, we have the scientific medical capabilities of eradicating it because we know what to do. But if you're out there in the middle of nowhere and you get this disease, I mean, it's already showing you almost 100% of the people die. Yeah. So I think that, but here in the United States, you know, what we're talking about now is like people that come in with these kinds of symptoms.
Yeah, it's more like 30-something%.
Yeah, like before, you know, you wouldn't even think about it being malaria. You're like, well, that's not even possible anymore, or very unlikely. If they're not traveled, if they got a travel history, that's one thing. But if you don't have a travel history, you know, that sort of thing, you're not, a doctor's not going to, his first thoughts are not going to be malaria.
Right.
Know, they're going to be like flu and that sort of thing. So it's what happens is once the parasite gets in the bloodstream and these symptoms are occurring, they get inside the blood cell, they alter the red blood cell, and then the red blood cell becomes basically not a form of what it was. And it's just got all of this parasitic infiltration, and it like will clot off the capillaries, which are the smallest blood vessels. And so when you do that, when you take the major circulation and then that is clotted off or clogged off, whatever, however you want to say it, the blood supply is not getting there. And so that's where you get into the whole thing of major organ failure, because now, you know, the kidney's not getting enough blood, the brain's not getting enough blood, the lungs are not getting enough blood, and so it starts that the cascade of doom, if you will. But you're looking at brain, kidneys, lungs, and the more extensive the parasite count is, the less chance you have of survival. So obviously a major problem. But I've got more things in here, like on how to prevent it and that sort of thing, but this would be a good time I want to hear what you've got to say about it. And then I'll go into more of the preventive modes.
Yeah, so let me wake up first.
Well, that was as exciting as an Elvis concert.
Yeah, exactly. Yeah, a current Elvis concert. So it's not a topic that you'll find everybody talking about, malaria. Excuse me. But you know, with it primarily affecting older people, pregnant women, and children under 5, it's something that needs to be studied, and it needs to be to the attention of we mentioned political earlier, but it needs to be done in a way that the politicians are going after, you know, regulations and that's as simple as screening. And I'll get to, because a lot of the cases, the ones that do happen here in the U.S., a lot of times they're coming out of the South. If you look, I mean, they're coming when we take in, or we were taking in, not currently, we've cut that down pretty much to, you know, I think the hundreds versus the thousands and thousands. But we've got over, 10 to 12 million illegal aliens, or migrants, if you will, whatever, undocumented, I don't care how you say it, you broke the law, you're illegal, that came into the U.S. The vast majority of those, and I know this because of talking to some of my law enforcement contacts that have to be down at the border, or National Guardsmen, when they process these people, they don't test them for malaria. If they've got some type of illness, they just figure they have the flu. A lot of times, these people are just bypassed and passed on by. We have no clue what is coming into our country right now as far as diseases. We're seeing some diseases, not going off on a tangent, that haven't been around since, you know, the turn of the century or back. Yeah. And they're being brought in because of healthcare, and it's not the people's fault that are coming in, other than the fact that, you know, they're sick, maybe just try and get some help with it. But it's because of the sanitation conditions, the living conditions. So it's very vital that, you know, the WHO get off their butt. I'm not their biggest fan. The NIH that wants to do research, I know some of their funding is getting cut out, but the NIH needs to step it up also, because looking at some of the research on the NIH, it's almost like somebody went to Wikipedia, created a bunch of stuff, and that's where they took the research. And I said, well, that research is incorrect, just based on all the other research that's out there. But that's neither here nor there. But we really need to push the fact that if we're trying to help other countries, we need to make sure that sanitation, because that's what breeds, you know, those mosquitoes get around that, and then it's filth, and it's the living conditions, the water, all this, and then everybody gets it, then they get in a caravan, or they get passed, they come into the U.S., and as Steve said, while they're starting to get a handle on it now, how many of the 10 to 12, we don't really know, plus gotaways, that are in the millions and millions? It only takes one to spread something. let alone get into you're talking to tens of millions coming in that maybe when spring hits and summertime and it gets hot, we don't know who's going to get, and I believe this is correct, if they get, like if somebody's got malaria and they get zapped by a mosquito, and that mosquito can then spread it.
Yeah, well, see, here's the thing too, and I'm sure you read this part, but like if you look at where a lot of these people are coming from, they're coming from, there is a significant portion reportedly coming from Africa,
yes,
Venezuela,
yep,
and South American countries.
Maybe 80s.
Yeah, so you're getting that. What happens is, like, okay, this person comes into the United States, and then they have malaria, and then what happens is they could get bitten by one of these mosquitoes. So a mosquito that doesn't have malaria bites a malaria infected person, and then they go bite an uninfected person. Now that person's infected, and so there's the cycle.
And that cycle starts with it, and which is what I'm saying. We have got to do a better job, and I think we're getting on that. Don't care what side of the political aisle you're on. It's important to get a hold of, the southern border and the northern border technically, and make sure that regulations and that screening. I don't care what your political affiliation is. If these people are seeking asylum, they need help, we have got to be able to slow down to the point where we are accurately checking these people and checking these children, all of them, for all of these things. And I know they say, well, it's not that big a deal. I think, according to the WHO, the World Health Organization, not the group that sings, is that, all puns aside, when you've got, over 263 million cases of malaria in 83 countries in 2023 is their current projection or current statistics they have, and right at 600,000 deaths from that. That's something you need to take serious, because it may be something minor here in the U.S. We may be the lowest out of the 83 countries that get it, but
not anymore.
No, yeah, that's right.
Not anymore.
Because now this could be a widespread epidemic on its way. And you just remember the Dr. Frank and Steve podcast. People go, malaria, that sounds boring. There's nothing malaria around. But you remember this come summertime and even late summer, as these cases start spiking, and along with others types of diseases, because we just such a poor job at the borders, making sure that we are evaluating people, as they come into the country. Again, I'm not picking on the people. It's our responsibility, if we let them into our country, to make sure that it's safe to do so. And if they need treated, get them treated.
Yeah. Well, the cat's out of the bag here. The cat's out of the bag. We don't have any clue what all of this means right now, but the ramifications of this are going to be felt for, I'm going to say, decades. Because, this is something, in my opinion, it's not being covered as much because I think it's not summertime,
right,
when these mosquitoes are out in full. And in my opinion, this should be a public outcry. This should be a public outcry, because what we, the American citizens, have been exposed to that shouldn't have been,
right,
is out there now. And so everybody's like, oh, well, they're, just like poo-pooing it, if you will. Wait till you get it.
Right.
Wait till you get it, or somebody in your family gets it, or something like that, and then it's not going to be so funny. Because as far as I'm concerned, it's a major health issue that
right,
has not been put
addressed
in front of the public as it should be. They're downplaying it, and this should be a public outcry.
Yeah, because let's say, and I know we're having issues right now, and as this video gets older, it'll probably still be the same, but like the USAID, whatever, funding. Some of the funding things are a little out there anyway, but I agree with it. I don't want a tax dollar spent on that. But, excuse me, we have a lot of good we can do. We can also take, and if we are testing and checking, and we say, man, it doesn't take a rocket science, or a rocket scientist, maybe it does, Elon, to figure that out, to say, the last 30 days, we've gotten about 100 cases of malaria coming through here. And they're all coming from these two main countries. These immigrants, or these migrants rather than immigrants, migrant immigrants, well, not my family was, but migrants who are legally migrating. But they're coming in. Maybe we need to not just stop right there and make sure they're treated and taken care of. We need to maybe bring the attention to the WHO. You should be doing your job anyway, WHO. And going into that country and saying, hey, there's obviously some type of epidemic going on here that's unrecognized. Let's put some money towards that. I don't have an issue with that, to make sure that if people do travel or come into the United States or any country, I'm sure sovereign countries, you don't want this coming into your country if you don't have the healthcare system to support it. But like Steve said, the cat's out of the bag. You know, you're set between 12 and 15 million people minimum that we have no clue what, you know, of what they're going to do.
We don't have a healthcare system to support it.
No, we don't.
We don't have a healthcare system to take care of it. And we don't even know how many cases are out there, plus these other diseases. As you can see, this has got my blood up.
Well, you know, and I've said this several times. I've had this discussion with both friends on the left, which are Democrats, and people on the right, which are, you know, Republicans, and with actual, state reps and people. And my concern is, because no one can ever answer the question, my concern from somebody who gets into statistics and, you know, tech and all that, even at my young age.
I'm not touching that one.
Yeah. So my thought process is, and they said they've never thought about it that way, and that who would think about that? But if you allow enough people within a few years period, say 3 to 4 years, you allow the number of people in that equals to the population of over 36 out of your 50 current states combined. You don't have the resources for that. We did not, in 3 years or 4 years, we did not all of a sudden plop out the number of hospitals, the number of police, the number of nurses, the number of workers, the number of resources to handle. It'd be like the United States going from 50 states to 86 states, basically, overnight. But we don't have the facilities, both medical, non-medical, all that, to handle all that. And people wonder why there's such a crisis going on and why there's so many issues. Those issues for supply chain and shortages on certain goods and medicines. Well, of course, you almost doubled the United States as far as the size, and not totally, but 36 states worth of people, that's a lot of people. But where's all the resources coming from? And I get the answer every time, well, it doesn't quite work that way. They just absorb it. You can't absorb it. If you've got a community or a state that's got 1 million people, now they got 2.5 million, who's going to translate? Who's going to do the education system? Who's going to do the medical? That's why we have such a shortage, Steve, and I've done podcasts on it, for actual MDs, or RDs, real doctors, for MDs, and we have a shortage in nursing. We have a shortage, actually, there's going to be more and more for nurse practitioners, physician's assistants, all all these areas, the shortages are just going to increase. So my advice to the U.S. and to Elon, because me and Elon like this, is that, see if the U.S. aid can come to aid here in the U.S. Why don't we offer scholarship, and I'm going to go on a tangent here, but
I'm just letting you go.
Yeah, so why don't we offer aid?
Just wake me up when you're done.
Okay, so why don't we offer the form of aid here in the U.S. to say, if you apply during this year or this year, we're going to open up X amount of medical spots for medical students, for nurses, for the critical services areas that the U.S. is so short on and going to be short on. Why don't we just make that? And I know people say, oh, that's you can't do that. Yes, you can. If we're sending hundreds of billions around and we don't even know where it's going and what it's for, and with waste, fraud, and abuse, why can't you fund through university scholarships, and then you can double check them to make sure we get all these students in there, the best and the brightest in the U.S., and make it tuition free for them. Housing, all that. I'd rather see my tax dollars go to that, because I know that my grandchildren and their children are all going to have enough medical personnel, enough law enforcement, enough whatever it is to be able to handle it. I'm done with that tangent.
Let's just put it this way. We are not having a constitutional crisis. we are having a healthcare crisis.
That's absolutely.
We are having a healthcare crisis, and it's not being recognized for the magnitude that it is because people don't want to hear that. And and that's what we're having. And so I've got some pretty much useless things on preventing malaria, but I'm going to cover it because
they're not useless if somebody needs it.
Yeah, but here it is. Mosquitoes to try to control it, mosquito nets, insecticides, and draining standing water that mosquitoes use for breeding grounds. And that could be like, that's old tires, things like that. I mean, just people just sitting around their house or around in the property. And wear long sleeves and long pants, particularly between dawn and dusk when mosquitoes are most active. And basically, if you can prevent a mosquito bite, you can prevent malaria, so good luck with that. But
well, in a lot of states, they also have where you can contact your local city or county. If you do experience where you see some mosquitoes, they will come like they used to do in our county. They will send a truck around in the middle of the night, and they will spray to take care of those mosquitoes to kill them off.
Yeah, well, and the thing is too, is for, the thing about it is like preventive medication, it is available for people, but they don't take it unless they're really kind of traveling to endemic areas, And the other thing too that I thought was pretty interesting about it is because you can't develop any kind of long-standing immunity to it. So like if you got Plasmodium vivax and then you get cured from that, there's 4 other kinds
that you can still get.
So you can develop.
That's messed up.
Well, I mean, it's just like there's no such thing as long-standing immunity, and so that that's an important thing. And vaccinations save about 30% of children's lives. But
do we still currently vaccinate for malaria?
No, there's no vaccination for adults. There's no for whatever reason. I tried to look that up, but I didn't.
They stick you for everything else here.
They do.
Needles.
Especially the bill. But anyway, the other thing too that I do think is important is that malaria is not, you can't get it person to person like the cold or the flu. I mean, if you're going to get it, because it's a vector-borne illness that's in the red blood cells. So obviously, transfusions, you can get it. Organ transplants, you can get it. Sharing syringes, or from mother to child, via childbirth. But I thought this was an interesting thing. About 1.2 billion people are high risk for this.
Wow.
And at one time in 2012, it killed 500,000 children before their 5th birthday. And in Africa alone, the 1-year cost of malaria in Africa alone was $12 billion. So you're looking at all of the things about the science involved in the disease, but there's political factors, there's so many different, the socioeconomic factors, there's so many things that are built into this. So it's not just some simplistic thing. I mean, this is
it has to be an all-in approach.
Yeah, and so, the thing too is that for the first time in 20 years, we are seeing endemic malaria here.
In the U.S.
It's been in Florida, Texas, and Maryland. So, and it's been mostly, I think, the Plasmodium vivax. But you're seeing, the problem is you're seeing endemic cases. These people, they didn't travel to sub-Saharan Africa.
Yes.
Sub-Saharan Africa came here. So, we don't know. I can't say that those specific places caused this, but let's put it this way. If you're in Maryland, Florida, and Texas, and you didn't travel outside the United States and you get malaria, that's a problem. That is a problem.
That is a problem.
And we do have Anopheles mosquitoes here in the United States, mostly in the South, but there's been malaria cases reported as far as north as like Cleveland and stuff like that. So, that's just a a problem.
Let me ask you, is there a standard test that doctors can run, or does that have to be done through like drawing blood? Or?
It's drawing blood, yeah. And they do have I think they have rapid diagnostic tests, but mostly it's like taking a blood smear and seeing the parasites on microscopy. But I think that the thing about it is that what is so important to stop it is like a public education system and a public surveillance system. And I started looking at all these different, they've got check boxes for each state and saying like, okay, for your basically disaster preparedness for this, and nobody passes. The surveillance system is just right now, the surveillance system and the public education on this are failing.
Woefully inadequate.
Yeah, and so that's going to be something that we're going to have to make a change to, because this disease will not go away by itself. It's just going to be here until we get a handle on it.
Right, and it's possible to eradicate it. We did it here in the U.S.
Yeah.
We just need to step it up.
Yeah. But my closing statement on this is that I think, to me, as a physician, as a been a patient in the hospital, I've got family, I've got a grandson, that sort of thing, and I'm looking at this, and I find this whole thing extremely upsetting, alarming, and I think there should be a public outcry about it. And I think there will be. It's just that until it really affects you, a lot of times you really don't care. But this is here.
Or a celebrity, or
and this is
profile.
Here. And then, as of yesterday, I was just reading. I get these American Medical Association alerts, and to my point, they discovered 24 new cases of measles in Texas. So, I mean, all of these things that were once just eradicated here.
That's funny because Dr. Adams, when we were doing a private lesson through Zoom, he mentioned the measles, and then yesterday he sent me some articles how the measles outbreak is just going ballistic right now, and there's not a lot of attention being brought to it.
No, there's not. I mean, and when I've seen things on television about all this, it's maybe like a minute.
Yeah, a little blurb.
Like about a minute.
A news filler.
Yeah, and it's almost like, as you say, a filler, and then let's go to commercial break.
Yep.
But it's like this.
When we come back, drag queens in Brooklyn.
Yeah, perfect. And so here we go. You're looking at something that it's not being talked about like it should be, and hopefully that we are going to help bring awareness about this, and it should be a public outcry. So
no, I agree, because there's so many, they seem to focus their concerns on what they think hot button topics are, but maybe we'll mention something, real quick. Like you said, we got a little time to pass before the tone hits to go to commercial or come back. And it is kind of sad, because I love that slogan. And I think everybody ought to be on that. We're not in a constitutional crisis, we have a healthcare crisis.
Yeah.
And that's the slogan. You heard it first here on the Dr. Frank and Steve podcast.
That's right.
If you'd like to use it, please email us, and there's a slight fee.
Well, it's just true.
Royalties, we call it here.
I'm just saying, it's just true. And the thing about, for me, is like, as a physician surgeon, I mean, to me, there's no more honest place than the operating room.
Absolutely.
That gets down to it, because that operation is either successful or it's not. You either live or you die. And so we're talking about healthcare affecting all of us, and it has ramifications in regards to physician shortages, physician burnout, all of these problems that everybody's talking about.
Physician retirement.
All this does is just throw another brick on the load.
Yes.
And it's going to be a very serious one, because this disease will kill you.
Yes, absolutely.
And that's all I really have to say.
That's good.
Yeah.
So if somebody would get malaria here, is it treatable?
Well, yes. The answer to your question is yes. But now, if you get a case of severe malaria, like child, older person, pregnant person, immunocompromised, those people have a significant chance of not surviving.
So they should be in early.
Yeah, I mean, so it's like if you have, it's very high fever, things like that, but they're flu-like symptoms.
You shouldn't walk around if you've got that accelerated pulse rate for like 8 to 12 hours.
No, it's detrimental to your health. It's detrimental. Well, that's a whole other podcast. But anyway, I think that we are bringing attention to this now, and anticipation of what we're going to be seeing in these spring and summer months, because there's going to be more cases of this without question. And so
the numbers are astounding when you look at it. People think, it doesn't really affect us here. 263 million cases in 83 countries and over 600 deaths.
Yeah,
that's a lot,
and we have to deal with that. I think that the United States. I do feel that we need to take a leadership role on it, because it's a global health problem. But now global health problems are coming here. And
yes,
and so it's like, but we're going to be,
and the cat's out of the bag, because we can say we can cut down, control the border all we want. What are the ramifications, the consequences, and what's the collateral damage that's being done from the past 4 to 8 years, whatever,
We don't even know.
No,
we don't know, but we know this.
But we need to jump ahead of it.
We know what's here, and we need to start getting the whole thing about public education, and I hope this is part of that. But the surveillance systems, when you read about the different things that are involved in that, and like,
well, as a tech person, it's not that difficult.
Yeah, we're not
ready. You can create a system.
Yeah.
Or you can create a system in a day. You can create a system. You can utilize blockchain technology, and along with that, Web3 as far as AI technology. And you could have because what you would do is use open source with other monitoring and statistical data cases. You'd be able to take all that into one program, and you'd be able to insert that with every healthcare organization, every urgent care, and just make it a mandatory thing. Listen, within 30 days, you've got to have this as part of your system. It's not that hard to adapt, and get that in there, and I think you should, not just malaria, you could look at it for the measles, for this, for that.
For all, that's it for me.
That's it for me. As always, stay healthy, stay safe. We'll see you at the next podcast.
Thank you so much. Bye.
Thanks for listening to the Dr. Frank and Steve podcast. If you enjoyed this podcast, please hit follow or subscribe on the link provided so you can stay up to date on new episodes. Until next time, stay healthy and stay safe.